The following program contains images of an actual surgical procedure that may be graphic and disturbing. Parents are advised that these images may not be suitable for young children.
If someone is interested in this type of procedure, they've tried everything else, are more and more centers across the country utilizing this freezing technology?
You know, they really are, Travis. I mean, the therapy itself is really new to the market, and you know, people are learning about it. We're trying to educate physicians and just let them know that, you know, physicians have a new tool to treat these patients that are frustrated and many of whom aren't responding to their traditional treatments. So, you know, it's absolutely growing very, very rapidly, and we're seeing a lot of doctors become very satisfied with the results.
How long will this result last, Dr. Weeks?
So far, we have about 3 to 4 years data, and so patients that have had treatment as long as 3 to 4 years ago are still having durability of their treatment. We do anticipate that at some point patients may need to be retreated, but so far it looks like it's going to last 3 to 4 years or even longer.
And will insurance cover this?
It is covered. It's covered by insurance plans, and it seems to be very well covered. So yes, it's covered by insurance.
And Dr. Weeks, I do want to ask, because obviously mucus production occurs for a reason, and there's an element of mucus production that is meant to protect us from potential respiratory infections. Are there any downsides to this, and is that one of them?
It's a great question. I mean, obviously the mucus and the mucus production is part of the immunologic component of protecting our noses. The way the study results were shown was that about 50% reduction in drainage and congestion is what we expect. So while you'll still have plenty of mucus produced, you're going to have enough that the patients are tremendously improved from a symptomatic standpoint, but definitely not at putting the patient at any risk for a dry nose. And again, last thing I'll say is really the only thing that patients experience occasionally after this is a little bit of an ice cream headache, but that's very low incidence as long as anesthesia is done properly.
And Dora, I know you're anesthetized, can't really talk normally. At least minimum thumbs up, thumbs down. How are you feeling?
Awesome.
Thanks for being here. Dr. Weeks, really appreciate you profiling that new treatment.
It's my pleasure to be here. Thank you guys very much.
Great job.
And one of the things I love about this show is being able to profile stories like that, because for people watching, that's a new procedure for us. You train in ear, nose, and throat.
Oh, this is brand new stuff. What I love hearing that it's for runny nose in general, whether it be allergic or that your body is just overstimulated and producing mucus.
In a procedure like this, again, this isn't going to be your very first step. You need to always figure out what is the root cause. And then the beautiful thing is, Dr. Weeks mentioned, this will treat numerous different root causes, but fascinating stuff.